So my project is broken down into 3 objectives. One of it is, the bigger role is I wanted to understand what the prevalence of HIV virological failure was like, particularly in East African regions. East African regions as defined by the UN. So that includes Uganda, Kenya, Ethiopia also is part of it, Tanzania and Rwanda as well. And so we're looking at the bigger picture, and this was helping us to also try and understand, because it entailed literature review in there and trying to understand what are some of the projects that have worked on HIV, and what are the predictors that have been reported, and what is the prevalence, yes, and what is the prevalence of HIV virological failure in this particular setting. And so that paper is already published. Maybe I would share a link to that. And so yes, that is one of the objectives, to look at the prevalency. It's more of like a systematic review, meta-analysis and meta-regression. So there were many methods that went into it, and some factors are, for example, one that was interesting was like the male gender is particularly likely to fail on treatment, because one of the understandings behind it is the males have low seeking habits when it comes to health. So even when when it comes to things like maybe they want to seek help and assistance, it's not as common as among the females. And another one was, of course, limited resources, because again, because there is not, like when you look at the facilities, people do not have, I mean, things like poverty affect how people adhere to the drugs. Things like stigma. So it was very interesting to look at some of those predisposing factors that make someone fail on treatment.